Good morning friends, I am Dr. Madhu. I am a consultant pulmonologist at Apollo BGS Hospitals, Mysuru. Today I am here to talk about respiratory infections. We know that tuberculosis is an age-old disease which has been there since a long time, and it is here to stay, especially in our country, India. Tuberculosis is a bacterial infection which is caused by a bacterium called as Mycobacterium tuberculosis, and due to the recent increase in stress, change in our lifestyle, increase in immunodeficiency syndrome like HIV, AIDS, usage of immunosuppressants, steroids, and lot of transplantations happening in our community today, we see a lot of tuberculosis cases even today. And this tuberculosis is not like the age-old tuberculosis with its usual presentation. It can come in varied presentations and may be very difficult to diagnose as well. So it is very important for persons who have cough for a long duration, or fever, or unexplained loss of weight, loss of appetite, or any change in lifestyle to also look into diagnosis of tuberculosis. Tuberculosis mainly affects lungs, lymph nodes. It can affect any other organ in the body and almost every organ in the body. Mainly I will talk about lung tuberculosis, which is known as pulmonary tuberculosis. It will involve the lung parenchyma, that is the main tissue of our lungs, and cause infection, and present mainly in the form of cough, fever, mainly during the evenings, and it is usually a low grade temperature, and loss of weight, loss of appetite. Sometimes people may notice blood in the sputum. All these features are usually the hallmark symptoms of tuberculosis. So anybody with a cough duration of minimum 2 weeks should get evaluated for tuberculosis. Tuberculosis is very simple to treat and it is curable. The duration of treatment would be 6 months, unlike other bacterial infections. So it is very important to adhere to the treatment and to the number of drugs, which is usually 4 to 6. And tuberculosis drugs are usually associated with side effects in the form of yellowish discoloration of urine, sclera, and some amount of gastritis, vomiting sensation. And these symptoms are usually correctable with other medicines, and usually they wean off with time. It is very important to adhere to the duration of treatment of tuberculosis to prevent the dreaded drug-resistant tuberculosis, which can be either in the form of multi-drug resistance, polydrug resistance, or extensively drug resistance, or the deadly totally drug-resistant tuberculosis, which does not have any treatment. Tuberculosis, though it does not remain a poor man's disease, it can affect any person of any social strata in our society, and it requires a keen look into the symptoms of the patient, good diagnostic workup, and proper treatment by a qualified physician. The World Tuberculosis Day is celebrated on 24th March of every year, and it is mainly to increase awareness of tuberculosis amongst our society. So stay away from tuberculosis and take proper treatment to be cured of it. Thank you.